Hi, hello, welcome to Kavya based nursing. In this channel, you will learn nursing subjects in the easy and simple way. Don't forget to subscribe my channel. Thank you. Today we are discussing postpartum depression. Definition: the onset of postpartum depression is gradual developing after the second week. The condition may last for 3 to 6 months, and in some cases it will persist through the first year of the baby's life. It causes much disruption of family life and mother baby relationship. It is observed in 10 to 20% of mothers. Causes: a specific etiology is unknown. However, certain contributing factors identified are experiencing stress-inducing life events around the time of childbirth, such as bereavement or relationship disharmony, low self-esteem, lack of support, and stress associated with postnatal care. Several maternal blues, later developing to depression, demands of mother bond, and loss of personal freedom. Clinical manifestations: out of crying, sadness, and emotional lability, guilt, and the loss of appetite, profound sleep disturbances, and poor concentration and memory, irritability, and feelings of inadequate to care for the newborns. Experience feeling asleep, but once asleep, the woman will sleep for long period, may appear over anxious about her baby. They often feel well in the morning and deteriorate in the evening. Management: early detections and initiation of appropriate treatment brings the best prognosis. If the midwife suspects a woman is depressed, this should be reported to the physicians. In less several cases, treatment with the mild sedations or antidepressants may be prescribed. Counseling will be useful at an early stage. When the depression is more advanced, admission to the hospital will be necessary. Untreated or undiagnosed depression can evolve into a psychotic illness. Nursing management assessment: impaired adjustment related to postpartum depression, high risk for maternal harm to newborn related to maternal depressions, anxiety related to changes in activities of daily living and inability to care for newborns, high risk for delay in attachment to newborn, and maternal role development related to mood changes, knowledge and deficit regarding newborn care. Nursing diagnosis: impaired adjustment related to postpartum depressions and high risk of maternal harm to newborn related to maternal depression. Anxiety related to changes in activity of daily living and inability to care for newborns, high risk for delay in attachment to newborn, and maternal role development related to mood changes, knowledge deficient regarding newborn care. Nursing interventions: impaired adjustment related to postpartum depression. Observe client with baby by yourself and with the family and friends. Discuss client's plans for her baby and for herself, and provide psychological support. Provide or refers to prenatal and postpartum support groups. Administer medication as per prescription. High risk for maternal harms to newborn related to maternal depression. Assess psychological factors, mood and support system. Reinforce clients' self-care activity and encourage mothering behavior and maternal role assist client with learning parenting skills and accept clients' feelings and provide reality orientations and keep environment safe. Anxiety related to changes in activity of daily living and inability to care for newborn. First, provide emotional support as necessary. Stay with the client when she is anxious and provide occupational and diversional therapy. Allow the client to give care for newborns and explain each and every procedure before going to do. High risk for delay in attachment to newborn and maternal role development related to mood changes. Arrange for adequate rest and sleep. Bring baby to client after she is rested. Explain positive aspects of baby to client. Allow other caregivers to care for the baby and encourage the client to take care of herself and then care of herself and then care of her baby. Knowledge deficient regarding newborn care. Explain about the needs of newborn and teach the parents to give support to the patients and explain the procedures before going to do and teach about the exclusive breastfeeding. Thanks for watching. If this class was helpful, please like, share and subscribe to Kavya Based Nursing. In the next class, we will discuss urinary tract infection in pregnancy women. Thank you.